Welcome back to Startup Health Now, where we celebrate the entrepreneurs and innovators who are transforming health. In a world where chronic diseases linked to poor nutrition are rampant and access to healthy food remains a significant barrier for many, a new member of the Startup Health Food as Medicine Health Moonshot Community is stepping up to revolutionize how we approach food as medicine. This week, our host Unity Stoakes chats with Cory Mitchell, D.Bioethics. As the founder of EntreVita, Cory is not just aiming to provide meals, he's building a future where personalized nutrition is accessible to everyone, everywhere. The genesis of EntreVita lies in a stark and deeply personal realization. The very people who could benefit most from the healing power of food often face the greatest obstacles in accessing it. Cory's journey began with the pervasive impact of cardiometabolic disease within his own family, a tragic pattern where nutrition-related illnesses played a fatal role. This personal connection ignited a fire to prevent similar suffering in others. Listen in as Unity Stoakes chats with Cory Mitchell about his story and what he has built with EntreVita.
Hello, my name is Unity Stoakes, co-founder and president of Startup Health. It's great to be here today. I'm really excited about today's conversation with another extraordinary health transformer, Cory Mitchell, who is the CEO and founder of EntreVita.ai. We're going to be talking about our new Food as Medicine Moonshot and all the extraordinary innovation going on in health innovation in general with Cory Mitchell. Cory, how are you, sir?
Hanging in there. Yourself?
I'm great. I've been looking forward to this conversation all week. So thanks for taking the time. Where are you today?
I'm in Grand Rapids, Michigan.
Okay, you're in Grand Rapids. So that's where you were last time. Well, great. So I've just been looking forward to this conversation, to interview you, learn about you as a health transformer, but also learn about the innovation you're bringing to the world and the Food as Medicine Moonshot that you're involved with and all of that. Really share your story with the world and, try to really understand what's going on in the, I think, this moment of great opportunity and innovation. So why don't we start with you and your background, because you're, what I like to call not just an entrepreneur, but you're a professor. You published all sorts of stuff. You've got all sorts of groundbreaking ideas that you put out there into the world. But just give us your genesis story. Tell us a little bit more about yourself.
Wow. Well, Genesis suggests long time frame, but I'll try to sum it up quickly. Basically, I grew up in abject poverty. Well, kind of two things. So one, my father was an entrepreneur who owned ice cream trucks and restaurant, fish fry restaurants and things like that, taxi cabs. So he was an entrepreneur, but he was also an alcoholic. And he built our house and he created stones that he patented for landscape artists, all this kind of stuff, right? And this was in Detroit. But then he killed himself, and then that's when we fell into abject poverty, my mom and I. And so I learned how to survive. I learned how to bounce back from trauma because he was also a violent guy. I loved him to death, but he was a violent guy. Bounced back from trauma. Learn how to speak again because I just shut down. So I had to go to speech therapy, got held back grades and all that kind of stuff. And fast forward, my mother then starts her adult foster care business. And she becomes the first Black female entrepreneur or first Black female millionaire in Battle Creek, Michigan. But she didn't know how to run the business. And so she invited someone who embezzled her. He took so much money that they couldn't pay taxes. IRS came in, took all her properties, closed it down. And then again, we're back in poverty. But music.
Is this what led you to become an entrepreneur, like being around
Yep.
your parents and your family and these kind of people who influenced you?
Yep, yep. And they all had diabetes. My sister, they're all passed away now. My sister, my mother, my father, all had diabetes. My stepfather even, and he was white from West Virginia, and they all had diabetes. They all passed away from obesity related or diet related conditions. And so, and I see this pattern play out over and over. And again, I'm a lifelong diabetic, and so dealing with that, and then my own struggles with it, but it wasn't until I saw it as a healthcare executive during a community health needs assessment where 60% of the population said one of their number one pain points was that they could not find fresh foods, fresh healthy foods that were accessible, convenient, and affordable in their community. So 60 to 70% were living in food deserts. And that was one Black urban community and one white rural community, both same problems.
Was this all in Michigan?
Yep, in Michigan. And so I said, we got to do something about this. And farmers markets aren't sufficient. That's not a solution. And I did a book chapter on food justice. I wrote a book chapter in Catholic bioethics and social justice on integral ecology and looking at food justice. And
Can I pause there? So how did you go from these extraordinary challenges and learning moments to then you're publishing books and bioethics, and you've always done these amazing things, but maybe walk me through for a few seconds on that journey.
yeah, so I was out of high school when I bounced back after therapy and all that, and getting my feet back under me. There are two things that kept me kind of grounded and resilient. One was music. I was a classical bassoonist. I was music. I was in music programs, so I played bassoon. And two was reading. I'm an avid reader, and so I read everything. My aunt was a nurse, and so she had all these books on chemistry and physics. I was reading Isaac Asimov at 12, and chemistry books and all that. And I was trying to figure things out, right? And I just love science. But I got recruited by Vanderbilt University to play bassoon on a bassoon scholarship. So I went down to Nashville, Tennessee, never been to the South as a Black male, hadn't experienced that environment, which was a hard reality for me back in the 90s. And that they wouldn't allow Tiger Woods to play on the golf course because he was Black. I mean, and those were leaders at Vanderbilt, that were making those decisions. And so I said, okay, this isn't the place for me. And then I quickly went home, dropped out, joined the Navy, and then saw the world, put out fires, saved people, got 3 Navy Achievement Medals and a Bronze Star for Valor, ran retail operations, all that, and then came back home because my wife said, I need you here. And I had the opportunity to go to Seaman Admiral program. My captain thought that I would be a great attaché at the Pentagon with him when he rotated out. But then I made the decision to leave the Navy, which was a tough one. And then I began pursuing education on a sort of real basis. I went to Johns Hopkins Bloomberg School of Public Health for a while as a research intern on a diversity program. And that was what piqued my interest in health more broadly. Began to publish then. So my first article was back in, I think, 2005 or 2004, somewhere like that. But I was doing research on social predictors of obesity. I was doing research on social integration for people at risk of HIV/AIDS, which was my mentor's pet project, doing things on cardiovascular disease and community environments. And so, and that was before it was now, before it was.
Right. You were very early on all of this. And I know a lot of the things you've written and published was quite early in the understanding of a lot of these topics.
Yeah. There weren't terms then. Now they're kind of tossed around. So that's where it started. And then I ended up getting I had to bounce around because I was picking up courses as I went and as I could afford. So finally got my bachelor's after years and years, like 10 years I was working on my bachelor's degree. Then I got my master's in healthcare mission leadership, which is a combination of healthcare administration and theology, Catholic theology. And so led, go ahead.
Well, I was just say you're sort of a polymath here. Like, how do you describe yourself, or you've done so many things? How do you think of yourself today?
Yeah, I mean, polymath is probably a good description. Wherever I can learn, that's where I like to be. I'm just fascinated by new knowledge, and I'll read it and accumulate it wherever it is. And I, look for ways to integrate that knowledge, right? Not just rote memory or anything, but how to apply it and integrate it. And that's what I do. So, yeah.
So let's bridge that to what you're building today. Tell us about the company you're building, how you're thinking about the solution and innovation, and also the category that it's in. Obviously, you're one of the founding members of the Food is Medicine Moonshot Community here at Startup Health, but there's, I think, so many applicable ways that your solution will impact many moonshots.
Yeah. So it's probably important to think about our company in two big pieces. One is the brains, and then two is the brawn. So the brains is our software, our AI, which is meant to. Our beachhead is type 2 diabetes patients who are experiencing maybe uncontrolled glucose, comorbidities, those sorts of things. And so we also are looking for those people who are struggling with the cost of diabetes. Back when I first was diagnosed, at some point during my diabetes tenure, I was taking 140 units per insulin a day. So that's 70 units twice a day, which is a lot of insulin. I was on Ozempic as well, and my glucose was still uncontrolled. I had cirrhosis of the fatty liver disease. And so I had all these things going on, and my doctor said, and I get my care at the VA. My doctor said, you're really sick. And if something doesn't change drastically, you're not going to be around to enjoy your son's graduation from the University of Michigan. So
that was a wake-up call for you.
Yes. And we had already started EntreVita. So EntreVita was but I started experimenting on myself, eating the recommendations, right? Taking my own medicine. And within weeks, my glucose was under control. They said I had a pharmacist and a nutritionist personal to me that I met with every month. And they said they'd never seen anything like that, so drastic. I was able to come off the insulin. So now instead of 140 units a day, I take 40 units. My glucose is well controlled. My cirrhosis, my fatty liver disease is maintained, so they're not worried about it. So I recognize the power as food as medicine. We're currently working on not only diabetes as a use case, but we have other use cases as well, such as maternal health, such as inflammation. And we in Alzheimer's, we talked about mild cognitive impairment and how inflammation and tau and beta amyloids and all that are related. Because I also worked at the NIH neuropsychology too, so I did some work on cognition and all that in aging populations as well. So I'm rambling, but
well, no, this is really good, because tell us what EntreVita.ai does and how you describe the vision of what you're working on.
Yeah. So really what we want to do is deliver real-time meal recommendation. Now remember, this is the brain, not the brawn. So the real-time meal recommendations targeted to your precise nutritional needs for your conditions, for, whether you're obese, whether you're pregnant, whether you have arthritis, your memory loss, these sorts of things, right? All these
personalized meal plans based off of your data.
in real time. Yep. Not meal plans, but meal recommendations.
Meal recommendations. Okay.
So you have the opportunity to fulfill those in multiple ways. So Instacart, and so you can cook them, or if there's a restaurant near you that has something similar or that you can tailor for your precise needs, we'll find those as well. So make a reservation. That's later on in the app, but it's a mobile app that's meant to put something in your hands that you can use to move the needle on your own personal health. And by the way, extant literature suggests that this approach can save diabetic patients about $22,000 a year. So, and reverse or reduce diabetes to the tune of 20 to 26%.
So that helps the patient improve their health, save money, but also their providers or payers or whoever's also maybe their employer who might be funding their healthcare as well.
It's a net benefit to the entire health system.
And so who do you sell to? Who would be your customer then at EntreVita?
So at EntreVita, and by the way, EntreVita is an amalgamation of French and Latin. So entre means to pass through in French, and Latin, vita, so life. So we're here to help all those who are passing through life, and we think that means all of us. So EntreVita. So,
and the .ai, of course, is AI.
That's just our domain, right? That's because we couldn't get .com, so we said okay, .ai. So
I love it. Well, it makes a statement, and I love how you're democratizing health in a way through the way you're coming at this by trying to make it accessible to more people.
Yeah. So that's how we start. Again, that's the brains, but what we want to do is integrate the brains down later stages. And this is why we think Moonshot is appropriate, because this is based on my book chapter. And this is a realization that this won't work. This moonshot won't work unless we make it ubiquitous. We have to be able to get food in people's hands. And so people in food deserts and people who are resource poor, time poor, also have problems, right? So how do we get food in real time to people? And so we're integrating robotics to put together kiosks with the EntreVita AI brain to be able to provide the recommendations, but to also be able to deliver a real meal in public settings, which would normally be like where people are getting most of their groceries, the gas station and convenience stores. So that would be a customer when we get down that road. And so our customers for the software, we have the customer and the end user. So the customer would be things like we're looking at exploring a partnership with Teladoc, who has 700,000 patients in their panels, and rolling it out as a service for their patients, white labeling it, and then the end user being the diabetic or the obviously the user of the app.
That's the interesting thing about healthcare, I think, because I didn't come from healthcare 20 years ago, and the first thing I learned was who pays is usually not who the user is or the end benefit, or even who benefits. It could all be different. So it's interesting to hear you describe that, because that's very much, I think, prevalent across the whole system of innovation. And one of the great challenges that us as innovators and entrepreneurs and creators have to contend with is who you got to go sell your solution to is oftentimes different than you're helping that diabetic patient or the person at the VA or driving through the convenience store, that's who you're really helping as well.
Yeah. So yeah, and we definitely want to make it. We want to make it also direct to consumer. So if people want to use the app, they can. It's $9.99 a month freemium, so it's not overly expensive. But we also want to leverage the relationships that providers have with their patients to scale quickly, right? And if you have 700,000 people that trust you in your panel, it's a lot easier for us to get that out for you to benefit as well with relationships. So it's not just us making money, it's revenue sharing and all that. And it's really meant to be a win-win. And really, I mean, in order to democratize health, we have to start with scaling and leverage, but also create opportunities for people to get meals where they are and eventually scale overseas as well. So we're starting obviously domestically, but we're looking at this as a global opportunity.
What are some of your, I guess, biggest lessons learned so far? You understand the need so deeply from your own lived experience, and you've studied and you know the research, you've created papers and you've written about this. You understand the industry and the community need, and you're building real world solutions and selling into the market. What are some of your lessons learned so far, and how do you see this moment of where we are in the innovation landscape? I think it's a quite an interesting time.
Yeah. So a couple of things. One is that there is a lot of competition in this space and people approach the problem differently. And that's a good thing. We think the more the merrier. There's enough market share for all of us. I think also that VCs aren't thrilled about hardware that delivers food to people. That's been an uphill because that's how we started. We had to backtrack and pivot to the software only, the app, right? Because VCs just weren't ready for either a vending machine or a kiosk, robotic kiosk, or any of that delivers precision nutrition for whatever reason. Maybe we just haven't found the right VC, but because it takes about $1.4 million to build an MVP for this thing. We have a partner in Atlanta that's cost is it.
So this would be an actual vending machine that could be in any food desert, rural or city, and it can deliver healthy food to people?
Yeah, and when we say food deserts, you think about those places where well-heeled customers frequent. So like charging stations where you might have to spend 20, 30 minutes there to charge up. You can and those are people who are health conscious to begin with often. And so, that's an opportunity for the 3,000 or whatever so charging stations in the country who are also customers or possible customers. So there's a lot of opportunity.
I mean, for anyone I've driven across the entire US on Interstate 80, and you might pass all the great cities and restaurants and places along the way, but if you're just on that route, you basically have 3 food options, none of them necessarily good, the entire way for 3,500 miles. So to have your solution there at every rest stop or charging station or gas station would be magnificent.
And you think about, I did a thought experiment with a couple of people. I was down in Indianapolis and I watched at a restaurant that was healthy, supposed to be healthy. They had some great food options, but the problem was the menu was so vast that the people would stand up at the menu and take 15, 20 minutes to figure out what it is they wanted to order. My solution was I went up and said, what do you like to eat on the menu? And they told me what their favorite thing was. And I said, give me that. And it was great. And so I talked to the owner and I said, if someone could scan their face, enter some biomarkers in their data, and you had a machine that could grill the food just like you did. You flip the food, you poured it on the grill, You flipped it, you put it in a thing, and you rung them up, send them home. Would something like that appeal to you? She said, I would love something like that. And she said, in fact, I'm thinking about franchising. And I said, I hope you do. And it was a she was African American. And I said, I hope you do, because I love the food. I love what you're doing. And I said, you put too much rice in the food for people with diabetes, so you have to change that. And I said, you got quinoa on the menu. So, that's good. So we talked about things like that, but she was like, oh, wow, I would love something like that. So I thought, okay, I know that's a sample size of one, but it is tangible, right?
It is. Walk us into the future, your future, and if you could wave a magic wand, what have you created? What's the impact? What's the outcome?
I love this question, and I think for me, I tell my team all the time. I said, what I want to do is get us to the point where we're producing, where we're like 3D printing food in space, like Star Trek. Most of them aren't old enough to remember Star Trek and how the food would get beamed onto the plate and all that. But I said that's where we need to go. I said if we can create cells in petri dishes, if we can grow meat, and if we can accelerate that process, we can create food in real time, prepare it, deliver it, and we can customize it to your unique needs. So when Elon Musk goes up in a rocket, or Amazon takes a blue orbit or whatever, a spaceship up, we want to be part of that and delivering meals to those people. Same thing, people on ships where I spent most of my time, the food is often crappy. You think about, and especially, people don't realize that you're on 12 on, 12 off often in shifts. And so the people that are on 12 during the day eat regular food from the mess decks. But the people who are in the midnight shift, they get mid-rats, and that's leftover food, and it's usually awful, and most people complain about it. Stores aren't open during that time of night. And so it's a real pain point for sailors, right? Or for anybody 12 on, 12 off. I fought fires. And so having people, fire stations, there's just a lot of police.
Sure.
So, yeah.
That's interesting. So really, again, I love that word, democratizing access to healthy food. You're thinking very holistically. It could be in the city, or it could be in a rural community. It could be along the interstate, gas station, charging station. For the food conscious or anyone else, So it's a really exciting vision that you have. What are your biggest needs? What are your biggest challenges? What do you want the world to know about what you're creating?
I think, well, our biggest need, we're like any startup in finance, is getting
Funding and customers, right?
Yeah.
Partners. Yeah.
Yep. So that's our biggest challenge. But I would tell you, beyond that, it's good relationships, right? It's good partnerships. We need people to understand that there is hope. I just spent my son's at the University of Michigan freshman year. We just spent this weekend at a golf clinic, Black Tech Saturdays with golf clinic. Now, I never heard of them, but I explored them, and it was phenomenal. And what I saw was there had to be 60, 70 founders out there, and probably 70-80% were obese. And I could tell, they had the shape, right? The central obesity, 40 centimeters or more index, 40 inch or more waist size circumference. That's basically an indicator of metabolic disease, cardiometabolic disease. And I was like, I so want all these people to know that we have something that will help them, avoid limb loss, that will help them avoid, premature mortality, all those things that go with diabetes.
Well, it all starts with food in so many instances. You mentioned diabetes, Alzheimer's, memory, aging, longevity. food as medicine is really central to all of this. What's it like to be part of a community and ecosystem that is all passionate about this concept, food as medicine? We had an extraordinary meeting the other day, I think, with about 14 of your fellow founding members in our community. What's that experience like, and what's it like to be part of a collaborative innovation ecosystem?
So I'm going to get spiritual. It's such a blessing, one, to be a part of an ecosystem that gets it, right? My desire is to spend more time in the ecosystem. We don't have enough time together. And it is, I'll just be candid. So, when you're doing this as a founder, there are times where you question yourself, you question what you're doing, you're like, okay, am I going to make payroll? Am I going all those things, right? And am I doing the right thing, or could I be doing something that's more profitable? And then I see people doing other things, and I'm like, why didn't I do that? But what this community did for me is made me fall in love with EntreVita all over again. Like it really brought the passion, and it made me double down and say, I need to do whatever I need to do to make this happen, because it's more than about money. It is really about the mission, and it's about saving my mom, my sister, my father, my stepfather, and all those people who never had the opportunity to live long and flourishing lives. So that's my story.
Wow. Cory, it's so beautiful. And, we believe you're all health transformers because you're the superheroes of our time. You are a superhero. I love to hear the genesis story from bassoonist to the Navy to Johns Hopkins to publishing research papers and books, and now circling back to the entrepreneur that has always run through your roots, and the visionary kind of thinking that you're bringing to the world is just quite extraordinary. It is a struggle. It is a journey. And thank goodness there's people like you who are pushing forward, because and thinking about the folks on the night shift or at the gas station or the charging station, or too often those deserts get forgotten about. So I just want to thank you, for sharing your story, but most importantly, sharing your passion, vision, and working on solutions for the world, and being part of the Food as Medicine Moonshot that will impact diabetes, Alzheimer's, obesity, cardio, longevity, Alzheimer's, brain, So thank you so much, Cory.
Just one more note. The fastest growing food desert, fastest growing demand for like in place food, industrial facilities, manufacturing facilities.
Wow.
They're built as food deserts. They can't find food around them normally. And if you go to Ohio, they have some of the fastest growth in vending machine adoption and other kind of technologies to bring food into manufacturing facilities.
I love it. Healthy vending machines, healthy personalized, food and meal plans and meals. So thank you. This is amazing. Any last things to share?
I want to thank you for making space for this, for being forward thinking, because it's not just us, it's the partners, it's the people who support us, and so we're all an ecosystem together, and it's the healthiest ecosystem is one that's symbiotic and mutually life-giving. And so I just appreciate being in this space of people who are like-minded and really trying to do great things for other people, for profit, people, planet, whatever. But yeah, it's great.
I love it. Next time we got to get you to play a few notes on that bassoon. Still got a bassoon?
I haven't played in years.
Oh, okay. All right. Well, cool. Thank you, Cory.
The true power of a community lies in its members. At Startup Health, the most visionary founders, CEOs, and innovators come together. These leaders are driving bold health moonshots with remarkable achievements and deep networks. Being part of this community means you're surrounded by the best, gaining access to a world of expertise, experience, and collaboration that accelerates your journey and pushes you further toward your goals. Everyone in this community is fully committed, creating a powerful, mission-driven environment where success is built together. Visit startuphealth.com to join us.